Okay, Randy, we got Evan here. We're going to do some self-treatment. So Evan's going to treat himself, and I'm just going to guide Evan how to treat himself. If you woke up in the morning with a sore neck, this is kind of how I would treat myself, and I'm going to kind of instruct Evan how to follow that. So let's make believe that Evan slept wrong. He's got wakes up with a stiff neck on his right side. Okay, so I'm going to just walk Evan through it. So he's going to take the Rehab 1000, put a dime size on the tool. He knows where it hurts, and so what he's going to do is just identify it. And the first place he's going to touch is with that blade is where it's going to hurt. So,
is there any specific way I should hold it or something?
You know, what I like for you, you're going to be going up to your neck. So this is a big area, so I probably want to use this form here in this contour. So that's how I would, just like that. And you would just put it on just like that, and I would just kind of right in that area, right. Okay, just nice and easy. That's it. And I would even come down to here, because that muscle comes all the way down here. That's the upper trap, all the way down here. And just long motions. Okay, and he's going to look away, because that's the area that hurts him. And then he's going to kind of take this pointed area and kind of just work on it in that area, just like this. How's that feel?
That feels good.
Okay, so you just, you left-handed or right-handed?
Left-handed.
Okay. And so he can really guide the motion and guide the pressure. And I would come all the way up here. And nice, and you can have me look down a little bit this way, and that really exposes that muscle, and you can just stay in that area right there. That's it. How's that feel?
It feels good.
And just nice and easy. Again, if he wants to get more specific, he can even turn it, and you can use this part here. So try that. Try to turn it that way.
This way?
Yeah, and see how that feels.
And that's sharper.
Yeah. Sharper. And he's got a little bit of a mole here. This is a good example. So you want to stay away from that. You don't want to knock that off or anything. So just stay away from that, and then just, it's about the same pressure. How's that feel?
It feels good.
Okay. The neck's a little hard to treat, but as you know, if you're right-handed, the right side's easier to treat. If you're left-handed, the left hand is easier. It would be harder for me to go over on that left side. So again, it'd be so much easier if you had an individual just say, hey, just come in here, a couple scrapes, I'm done. But you can see he's got a little alopecia. But he can, that's how I would treat it. How's that feel?
It feels good.
Okay. So let's say, and you know, Evan's a avid tennis player, and so he's left-handed. So we're gonna let's see. For you, because you're left-handed, we do this. We use his right hand, so it's a little bit harder for him to use. But let's say his left, he's got a tennis elbow, and so we would put dime size on the PMT tool, put it on there. Yep, scrape it on. Okay. Looks like you've done this before. Good. So then he's using that well.
Is this grip
yeah,
okay?
It's perfect.
Okay.
Yeah, that's what I like. Just like that. And again, the grip is going to be different. My hand's bigger than Evan's, and we're coming up with a tool that's smaller for smaller hands. And so it really, that's the way I use it, but really it's your own paintbrush. You do it in your own canvas. You do it the way you want to do it, and it's more comfortable and more efficient. I have several therapists that work for me, and we all use it differently. Yeah, there you go. And then if you want to expose that tendon, what are we going to do? Bend that wrist down. Yep. Yeah, and then he's looking for that area that's most painful, and it's probably going to be right in here. And he just stays in that area a little bit, works that a little bit, and then he takes big swipes. Get that stuff out of there. Then short strokes, and then big swipes. That's good. How's that feel?
Feels good.
So yeah, you can do that.
I can see it's getting,
Yep.
it gets more red here.
Yeah. So that's where you have to kind of spend some more time on. And again, each area should only be treated for 2 to 5 minutes. 5 minutes the max. And again, depending on if you're going to treat the whole back, you maybe can spend 7 minutes. But if you're going to treat the elbow area, I treat probably 2 to 5 minutes. Done.
So when you're self-treating, basically whatever part of the tool feels comfortable for you will work.
Yeah, there's no part of the tool that isn't effective if it's effective for you. Correct. That's good. And then, let's say he has a knee problem. Let's say he has a little bit feels some pain in his...
I do actually have a little bit of a knee problem.
Where is it?
The patella tendonitis.
Okay, so he's got some pain right in here. Okay? And knowing that he has pain there, again, we're going to put a little bit of... And I like to put it on the tool first, then put it directly on it. But sometimes if you put it on, it kind of drops on the floor or whatever. I like that. I make sure I don't put it on my hands just because again, it can, just like anything, it's capsaicin, it get in your eye,
Mhm.
and it can sting a little bit. So just keep it on the tool, and let's have you put it on.
Just right on the knee?
Yep, right where you think it hurts the most. Okay, good.
Right
And
on
just
there.
paint it on there. Okay. Okay, so it hurts right there. And again, he can go as aggressive as he wants. And the tendon is right there, so he can go pretty hard. And what's another thing is he could extend and flex that knee while he's doing it. And now it's a pretty good coordination there. It's pretty good. And so now this is a good one though that I like is I like to turn it this way. See if that if you can
Yeah,
do that.
that actually feels better
Yeah.
that way.
Yeah, see if you can do that. And then you can do it up and down. And again, he's looking for restrictions. And the tool itself is going to cause the breaking of the scar tissue. It's also going to increase circulation. It's also going to increase lymphatic drainage. It's going to heat the area up along with the Rehab 1000 is going to do all that. And so he'll be able to feel some warmth for 24, 48 hours in that area. And it may go on and off. Yeah, that's it. So really, basically, you can treat any part of your body that you can reach comfortably, and it's effective. That's it. And then I usually just wipe off the excess. And the tool, just wipe that off. And to keep this clean, just usually wipe it down with a little alcohol, and it's done. It's got an antimicrobial coating on it to help ward off any bacteria anyways, so that's it.